Alright, so for the next heart issue which we get to discuss this evening is what is known as a mitral valve incompetence. Alright, mitral valve incompetence. Alright, so talking about this specifically, we are making emphasis on in children. So mitral valve incompetence, of course, you just have to do with the valve on the left side that is in between the atrium, that's the left atrium, and the left ventricle. Do you understand? So this valve is controlling how blood is flowing from the left atrium to the left ventricle. So of course, anything that actually happens to this valve, it will affect a lot of things. All right, now these are the things we're actually trying to look at. So is the incompetence. Now incompetence can be caused by many things, so look at also the possible causes of this issue. So for the mitral valve incompetence, we said that it's also known as mitral valve regurgitation. So let me just explain these once and for all. Blood is supposed to flow one way from the left atrium down to the down to the left ventricle. Do you understand? So anything that has to do with blood moving from the left ventricle back to the left atrium, you have this issue coming up. So it's a condition in children where the mitral valve, that's the valve that is between the left atrium and the left ventricle, so it is failing to close properly. So you have like a backflow of blood back into the left atrium, which is not supposed to be there. Alright, which is not supposed to be like that. So causes of mitral valve incompetence, so it could be congenital or acquired. Congenital simply means you are giving birth to with this issue. Acquired meaning you are having this condition because of some one or two things coming in. Do you understand? So for the congenital one, that's the one that you were born with. You have things like mitral valve dysplasia, we have atrioventricular septal defect, we have the Marfan syndrome, or any other connective tissue disorder that is making your connective tissues to be abnormally so soft. The acquired ones, these ones you actually got it as a result of your activities here and there, you acquired. So you have things like rheumatic fever, infective endocarditis. Then sometimes it's due to some direct injuries, or maybe they did some surgery. So after the surgery, you are having this as a complication of that surgery. Alright, so simply just know that blood is no longer flowing one way, but blood is now flowing back into the mitral valve, into the left atrium. So symptoms, how will the patient with this actually feel? So they are tired, and if you ask them to do any exercise like climb the stairs, they have issues in doing that. Shortness of breath, palpitations or irregular heartbeats, swellings in the legs or abdomen, poor feedings, they are not feeding well. Alright, heart murmurs, you have a lot of sounds in the heart and all of that. So some children may remain asymptomatic, that's like they are not having any issues for years, especially in mild cases, but some people show up with these issues. So diagnosis, I'm just trying to do all those heart things: echocardiogram, electrocardiogram, chest x-rays, cardiac MRIs. All of that will help me to know, to establish that the disease condition exists, and also to know at which stage it has actually affected that patient. Alright, so treatment options. Sometimes if it is mild, you just observe. Then sometimes you give some medications to deal with all those heart failure, Then surgical repair. Alright, then sometimes if the repair will not help issues, you totally replace the valve with a man-made valve, which is usually done through surgeries too.